Assalamu alaikum jami'an. Good morning and welcome to the Black Box. My name is Hugo Sheikh and I work for the Office of Development Affairs, and I have the pleasure of introducing our wonderful speakers. GCC countries suffer from some of the world's highest obesity rates. This prevalence of obesity is driven by the region's rapid urbanization, economic prosperity, and I would say the lifestyle factors. In this session, it is an honor to welcome His Excellency Dr. Ahmed AlKhazraji and Hugo Harper to have a wide-ranging discussion on what does and doesn't work to reduce obesity in the long term. His Excellency Dr. Ahmed AlKhazraji is the Executive Director of the Healthy Living Unit at the Abu Dhabi Department of Health. Previously, he led Abu Dhabi's health agenda through different initiatives and programs as the Director of Health at the Abu Dhabi Executive Office. Hugo Harper is the Director of a Healthy Life Mission at Nesta, a UK innovation charity. He brings over 13 years of experience working in all aspects of public health, but has focused in recent years on developing practical policy tools to tackle obesity. This conversation presents an opportunity to explore how policymakers and industry can combine evidence with innovation to encourage healthier choices. I now welcome to the stage His Excellency and Hugo.
Right, so I guess we'll kick off then. Hi, good morning, everybody. Thank you for joining us this morning. My name's Hugo Harper, and we're here to talk about changes to fight obesity this morning. I'd like to kick the session off by asking Your Excellency, could you tell me a little bit about the Healthy Living Unit?
Sure. Before I start, we were having a quick conversation at the back about how to approach this session. He thought I was he was being interviewed. I thought he was interviewing me, and we thought, let's make the best of this and just ask each other questions. So the list of questions that we have, he's going to start asking me, and then I will ask him and make this something that's a bit more interactive and fun. And we want to leave some time also for the audience, for you guys to ask us some questions. So I'll start first. Thank you, Hugo, for the question. So the Healthy Living Unit essentially is a delivery unit, and that was recently established a little under 3 months ago. And as a delivery unit, our job and what we're working on, myself and my team every day, is working with departments, working with line ministries, and other government entities, essentially to de-bottleneck problems and to accelerate the delivery of priority programs and initiatives that are very important to the government here in Abu Dhabi. Now, as a delivery unit in and of itself, it's not anything, it's not unique in that there's been many examples of successful delivery units around the world, in the UK, in Malaysia, and in many other countries. But here in Abu Dhabi, the Healthy Living Unit is the first of its kind in that it is focused exclusively on healthy living. And we did this for a particular reason. Healthy living in and of itself is a multifaceted topic. It's people's personal behaviors, so things such as physical activity, diet, sleep, their social interactions, their personal attributes, so things such as their genetic makeup, their metabolism, their mental well-being, environmental attributes, things such as housing, urban planning and design, air and water quality, and also the health interventions that people get, so pharmaceutical care, medical and surgical care. All of these things and more make up healthy living as a concept. And there is many government entities across Abu Dhabi that tackle these different facets, whether it's influencing, whether it's regulating, whether it's operating, to address those different points that I had mentioned on one side. And then on the other side, when we look from a purely health perspective, we know globally and here in Abu Dhabi, though we are making some significant enhancements to that, but it still remains the case that the way that people engage with health systems around the world just isn't effective and is not working, right? They wait until they're sick, they go to a doctor, and at that point you're reacting to the disease instead of working on preventing it in the first place. So we keep all of this in mind, and keeping all these points in mind, we were thinking as we were designing our very bold and ambitious agenda of creating the most active population supported by a healthy food environment within a health-conscious population. We realized that there were some gaps here in Abu Dhabi. On one side, who is setting the healthy living agenda for Abu Dhabi, and who is outlining what are the critical drivers for healthy population lifestyles? Who is aggregating and orchestrating the many different initiatives that touch on the facets that I had mentioned before, right? Whether it's through the government, private sector, etc. Who is providing leadership and guidance in the design of these initiatives? And as well, once they're launched, assessing their impact in the right way. Who's also coordinating the allocation of resources that we're dedicating towards healthy living and making sure that they're going to the right organizations for the right reasons, right? And lastly, who's communicating the collective success of all these initiatives and really showcasing Abu Dhabi's unique approach. So that's essentially how and why the Healthy Living Unit came to be. And we're very confident that it's going to serve as a blueprint and really a global reference case for addressing, Hugo, as you know, the biggest health crisis that we're facing today and are going to continue to face for the foreseeable future, which is the continually increasing prevalence of obesity and other lifestyle diseases.
And it was so interesting chatting yesterday, hearing a little about what the plans were. And people often talk a big game when it comes to preventative health, and it felt like you might really do it here. That sort of the focus on delivery and the ambition felt real in a way. I've been involved in many conversations over the last decade or so on prevention, and lots of people talk in generalities, but it was great to hear some of the specifics that you've got planned.
Wonderful. My turn.
Yeah.
So this is a question actually that we spoke about quite in depth yesterday, and my team and I have been thinking a lot about, which is, should we be comfortable making policy decisions based on good enough evidence? How do we navigate the tension between needing strong evidence, like randomized controlled trials, which in the field of healthy living may be very hard to generate, and needing to act now? So what are your thoughts on that, Hugo?
So we did a piece of work last year. Well, we published it last year. It took us 2 years to do it, where we looked at the strength of evidence, the potential impact and potential costs of about 30 policies on obesity specifically. And what we found was that there was not that strong a correlation between strength of evidence and likely impact. And this is things people often conflate. People assume good means good generally, and you can have very, very strong evidence that something doesn't really work or has a very, very small impact. And you can have medium quality evidence that something could have an amazing impact. And that's what I suggest people push towards. And it's interesting working across different policy areas, because one of the great things about health is that we have so many RCTs. The experimental approach in health science in particular has seen transformational results over the last 40 years. But it can also mean that people think that's the only way to get evidence. And that's simply not the case, right? You can't run a randomized controlled trial on a national sugar tax. It doesn't work. You need the scale of it to work. And so we need to be bold in our ambitions and not sort of myopic in our view, because that tends to push people down a treatment lens. It's really easy to run a randomized control trial on a weight loss treatment or a weight loss drug. You give it to some people, you don't give it to other people. It's much harder to do something in terms of, run that sort of evaluation in terms of, let's say, building new facilities in a community. You'd have to have lots and lots of different communities. And so where I would urge people to focus is not what has the most robust evidence, but what do we think will have the biggest impact. And that requires bold leadership. That requires people not just deferring to what's ever in the latest Lancet article, but saying, in my context, in this context, this is what we believe will work. And that's the role of political leadership, right? That's what you want to see. That's why politicians or sort of civil servants aren't academics. That's why it's not the same job. And so we try to bridge that gap. We work a lot with academics, with policymakers, with public, with industry. And I try to think about it not as what is the very best evidence that would work, but what is your best bet? on what will work. If the decision is yours, what are you recommending to the Prime Minister, the Health Secretary, whoever? And I think that often leads people to different answers, and answers that are more important for having good impact.
Excellent.
I wanted to ask you a question about the sort of interplay between government and the private sector, and what you have planned here. So what role does government, investors, and the private sector each need to play to meaningfully reduce obesity?
Thank you. So it has to start with us, with the government, in my opinion, in that we need to be very clear and very intentional in our desire to tackle obesity and other lifestyle diseases. And at the same time, having a very clear prioritization. You cannot tackle all of the drivers of obesity at the same time. So yes, we're going to do it. We've committed to doing it, and this is how we're going to do it in terms of a prioritization approach. On the other side, we also have to be willing to trial new and bold and innovative interventions that, again, can tackle these preventable diseases, but obviously are continuing to grow, as you and all the audience knows. And do them as pilots, get the lessons learned, course correct, and then implement these at scale. And at the same time, we need to recognize and publicly thank those companies and organizations and individuals who are championing our public health and population health and health promoting policies and initiatives. Publicly say to them thank you, and recognize them if they're contributing to this mission that we are going on. Essentially, we need to match the scale of our ambition with the scale of the challenge. And that is something, as I mentioned to you yesterday, and many of you have heard, and I can say with full confidence that we are doing that here in Abu Dhabi. So that's with regards to government. When we look at investors, they play a catalytic role in terms of helping it meaningfully address tackling these diseases. So on one side, they can actively invest in companies that develop and market and scale healthy food and beverage products, actually invest in those companies and help them grow. On the other side, financing infrastructure projects that enable people to live healthy. So things such as urban planning projects, or building of new fitness facilities, or courts and parks and pitches and things that, again, enable people to be active and live healthy. And at the same time, publicly champion the government policies that are meant to drive healthier living across the population. There is one initiative that we are heavily working on that I do want to flag as well in that regard, which I was telling you about yesterday as well, is what's called integrated fitness infrastructure, where we are looking at all 70 districts across the Emirate of Abu Dhabi. And we're starting with 5. We've identified 5 priority based on a specific methodology. And we look at the demographic, within those 5 districts, we look at the demographic information. We look at the socioeconomic information of that district. We look at the health outcomes of that district, obesity levels, hypertension, etc. We look at many different variables, and then we identify specific plots. And we are soliciting investors, private investors, to come and to build, like I said, those facilities and parks and courts and pitches and walkways and things, again, that enable it. But we're doing it in a very targeted way, and the ones who, again, want to join us with that, we will be much appreciative of that and also recognize them and thank them, because ultimately we're doing this to improve the health of citizens and residents in Abu Dhabi. The last thing that I would say, or the third part, is with regards to private investors, private sector. And I would see their job is to transform, which they already do quite well. Transform in terms of reformulating the products, the food and beverage products that they consume, reformulate the amounts of sugar, the amounts of salt, the amounts of saturated fats and trans fats, and make those healthier. On the other side, increase the offering of these healthy food and beverage products, and as well, portion control. So make the portions of the products that they sell smaller and healthier. And these are important ways that I would see them all playing a role. But there is a very important point that I do want to mention. We have a lot of initiatives, which I'm going to ask you as well what you guys are doing in the UK, and we want to tell the audience also what we're doing here in Abu Dhabi. But a very important point about not taking the joy away from food. It's a sensory pleasure. When we go to a restaurant, when we go, we spoke about this yesterday, it's something that's a pleasure. We don't want, through the efforts that we are doing for anyone, whether it's consumers or industry, to feel that we're taking that joy away from them. So that is a mindset that we most certainly come with.
I think that was just a couple of points that you picked up on that I really like there, is not being able to tackle it all at the same time. There's something in the UK, it was called the Foresight Map for Obesity. It was done in 2007, I think. And it basically looks like a big bowl of spaghetti. It has a systems map of all of the different ways that things that influence obesity. There's more than 200 arrows on it. You look at it and you think, like, how do I even begin to start tackling this? But all of those arrows aren't equal. You know, some of them are much more important than others, and zooming in on those things and sort of being clear about what government is going to do, I think, is a really important part. And similarly, we were agreeing a lot yesterday on some of the things on like reformulation or portion control, making it easy for people. In the UK, Sprite, there's no full sugar version of Sprite anymore. Doesn't exist. It still tastes the same. And I took a photo of one of the Sprite cans here the other day, and it shows the journey you can go on. And one of the interesting things about that is that within the UK, before that happened, there were basically 3 big brands of that kind of drink. There was Sprite, 7-Up, and Schweppes lemonade, and they had 11 grams, 7 grams, and 4 grams of sugar per 100 ml. And if you served them to anybody, they couldn't tell the difference between them. So you could already show that people didn't actually mind. It was this sort of presumption that people wanted higher sugar. And so we've had a successful journey of showing that reformulation. And what's been interesting is there's been 0 consumer backlash. The businesses are actually selling more drinks than they were before. So it's an example of something that can be good for health and good for business.
That's a very important point. Besides, spoke about the joy of food and the importance of that. At the same time, we have a number of initiatives that we are implementing, and what we very clearly state in our engagements now with industry, and I say this publicly, is not only do we want these companies to continue to be profitable, we actually want you by the end of this journey that we're going on to be even more profitable. We get it. We understand both sides. But consumers are more health conscious. They're demanding healthier food and beverage products. And as well, even top talent now, in terms of the companies that they are joining, you're thinking, why should they care? Right? We talked about why should these companies care? Besides that, if left unaddressed, they're driving up massive costs, which reduces productivity, which increases chronic disease prevalence, which impacts bottom line. And then the taxation also reduces value. But at the same time, top talent, they want to work for a company that not only says we have wellness and health as a priority, but actually seeing those in action, right? And with regards to that reformulation, as you spoke about, it's not, and it goes back to the taste, which is very, very, very important, right? If food doesn't taste good, you're not going to eat it. Doesn't matter how healthy or unhealthy it is, generally speaking. But that reformulation approach is not something, as you guys have worked on in the UK and we're embarking here in Abu Dhabi, it's not something where we are pushing for extreme reformulations in a short period of time. It's progressive. And when we initially started talking about these initiatives that we're working on, there was a fear that, we want to bring sugar down by 50% tomorrow. No. Over a 12-month, a 24-month, a 36-month period gradually. As long as you commit to targets and we agree together on how to achieve it, to keep that objective, right? To keep food tasty and to keep you successful, because Abu Dhabi is a place where we want you as a business to come and thrive.
And it's such an interesting point. My background's sensory psychology, and the human brain, its point is to detect change. We are very, very good at noticing relative shifts in things. We are very, very bad at sensing objective levels. If I asked you to estimate what number of decibels we're speaking at the moment, you'd have no idea. But if I start speaking really quietly, you notice really easily, right? And so if you see these drastic changes, you'll notice it if you reduce the sugar by 50%. And in the UK, we've had reasonable success at salt reduction. That's, again, something that's a relative sensory perception, right? And now I notice if I go to sort of South America, the food's much, much saltier. It becomes very arresting the first day that I'm there. By the end of the 2 weeks, it tastes normal to me. And so what can we do to not reduce any of the sensory pleasure people derive from food, but gradually change it over time so that they're getting the exact same enjoyment from it, but with stuff that's healthier for them? One of the other questions that we were interested to discuss was around if there are examples that you're aware of where sort of cross-sector collaboration has successfully led to healthier population outcomes, and particularly on that, you were showing me some of the amazing data things that you're planning, and that was something we'd love to hear a bit more about, the sort of combination of how you're planning to use data in both the sort of more traditional healthcare settings and the more preventative healthcare aspects.
Absolutely. So I'll start with the second question first. The digital enablement in our approach to healthy living, and not just healthy living, also from the public health perspective, so what's happening at the Abu Dhabi Public Health Center and associated initiatives, and then also from the healthcare perspective, treating those people that are sick. That digital integration is something that we are hardwiring across everything that we do. So I was showing Hugo yesterday for our Sahatna app, which is, for those of you who aren't familiar, I encourage you to download it just to see the functionality, and it'll serve you in your life. It's a super app that brings together your electronic medical record, so everything related to your individual record you can see in it. It has, if you've gone through the Emirati Genome Program, you can see your genetic report and also what things you are at risk for. You can directly schedule appointments from it, and you put your location, it'll tell you the closest clinic by specialty, by doctor, by etc. And as well, you can do teleconsultation. So for example, you can't go, or you need in between, have a 30-minute window and you're worried about something, a quick teleconsultation call, you can take it from there. We're going to be launching very soon an AI symptom checker. So, you're having a weird symptom, you can ask it and it will converse with you. It's a lot of great functionality, and very importantly, it integrates with all major wearables. So today, the data that we have, frankly speaking, it's good, but it's not enough. And this is something not just here, and everywhere around the world, in that we are taking extrapolated assumptions of how much people move based on surveys or single points in time. By linking your wearables, your Whoop and Apple Watch and everything, with Sahatna, you can see it in real time how we can't get into the individual's account. I just want to be very clear about that, because I don't want anyone looking at my account, and we won't look at yours. But what we see is trends of specific segments of the population over time. Is that. So digital, we have disease registries that target, we have a whole bunch of stuff. But my point is that digital integration is hardwired into the efforts that we're doing, and will be hardwired into the efforts that we're doing on improving physical activity. And to the first question with regards to the example, I actually like one from the UK, which we were talking about yesterday, and it's important. It's so powerful to show the impact. In summary, the UK government brought together the leaders of the major retailers and food and beverage retailers and manufacturers, and collectively committed to reducing, to reformulating their products and reducing the amount of salt that was in it. So there was over an 8-year period, a 15% reduction in the amount of salt across food and beverage products across the UK. And during that same period, they found a 42% reduction in stroke-related mortality. So out of everyone who had the people that died from a stroke, that number almost halved during that same period. And they accounted for everything else. They accounted for socioeconomic status. They accounted for where they live. They accounted for gender. And it's published in the British Medical Journal. I encourage you to read it. But it just goes to show you. We have many examples, but I'm just conscious of time. Many examples, but the one from the UK I really like, and thank you guys really for your work on it.
And that's an example of something that I'd love to draw out, which is what can be surprising in obesity and health more generally is how small a change can lead to such a big health outcome, especially across a population. So at Nesta, where I work, we have a mission to halve obesity. And what actually is required in order to do that at a population level, so at the UK, that would bring us back to sort of 1990s levels of population weight. That would be an average reduction of 216 calories a day. It's about 8.5%. It's about a bottle of Coke. It's about a Mars bar. It's something like that. Your daily calorie intake goes up and down by way more than that each day, and you don't notice. And so this is the prize, right? You can have a massive improvement in health that we saw with the stroke data on SALT by making changes to diets that do not reduce people's joy from it, and that have huge benefits to the population in terms of their well-being, in terms of productivity, and in terms of reduction in healthcare costs. And so people sometimes think of obesity as this impossible thing, this sort of like train that we can't get off. And I think we should be really optimistic about the potential progress. And I was certainly inspired hearing what you have planned here in the UAE to try to sort of buck that trend.
Thank you. You've answered the last question, which is the important point about you don't need to make major changes to your diet. It's small changes. 216 kilocalories. I was wondering why that number specifically, but if you cut that amount out, a Mars bar, a can of soda, over a 12-month period, that's 10 kilograms that you lose, or 22 pounds for those that do the other system. Just that, right? So those small incremental changes that are sustainable, compounding over time, is what's going to lead us to that. And we've seen that in the UK, we've seen that in Singapore, we've seen that in many other places, and we're going to be implementing that here in Abu Dhabi. Thank you. We were wondering if we want to leave time for questions for the audience, and I think we should. Maybe take one question each. Are you okay with that?
Yeah, very happy to.
So if anyone has any questions, we welcome it. Go ahead. He can't رافع ايدها اللي وراك. Is there a microphone? Somebody who can? No, you stand up. Just raise your voice.
Thank you for this very interesting discussion. Actually, I want to take it from the UAE perspective and from UK perspective, since I think UK had lots of efforts in reducing salt and sugar, I think, for most of the food items. So here in UAE, as you know, we are 7 Emirates. Abu Dhabi is doing lots of initiatives, Dubai and even the rest of the Emirates. Yet when we are tackling or communicating with companies and businesses, and we focus on certain areas or let's say cities, how that would work if we compare the efforts in different cities. If I would explain it better, if I'm doing a policy on a Abu Dhabi level, how that would affect or impact the other Emirates and vice versa. Because sometimes if I do it very strictly in Abu Dhabi or perfectly, it's the same company that supplies to Dubai, and then the business competition would be a problem, right? So how I want to take your perspective on that. Yeah. Thank you.
I'll let you answer that one.
Great. So there's sort of two parts to that. One is a more evaluation part. Do you get a clean read on what's happening? Like it might be that you were thinking of using one of the other Emirates as your comparator point, right? We've changed it here. Has it changed there? Well, then you might have something called spillover effects, right? Actually, the changes have, let's say they've reformulated a product here and they sell the same product in Dubai. So you would see the same changes there. And so what you can that sort of brings us back to one of the first questions, like what type of evaluation are you looking for here? Now, if you look at metrics that are too far away or sort of long-term or high level, you can fail to find a solid change in what you're looking for. So an example in the UK, when we introduced the sugar tax in 2016, if you just looked at obesity rates in the UK, they didn't drop. Right? And that's because sugary drinks consumption is a very small part of what people consume, and a bunch of other stuff kind of washes out that effect. If you look at the sales data for sugary drinks in the UK, you see that reduced by about 43% in terms of total amount of sugar. You saw the absolute number of sales of drinks went up. And so I would encourage people to use sort of quite detailed proximal sales data, which you can get hyper-local for. You know, you can look at like specific stores or specific towns, and that's something that we're really interested in the UK at the moment. And I sort of view a lot of it more as a positive. for it. So again, a lot of the efforts that we've seen for the sugar tax in the UK have spilled over to the drinks that you get in Europe, in France, in Ireland, and places like that. And so one of the things I'd sort of encourage is, can you sort of test out different things potentially in the different Emirates, and then hopefully you all experience the positive spillovers of that together. One more point just on the evaluation, that maybe a sort of a difference. We're reasonably lucky in the UK to have quite a long time trend data. We have data that goes back quite a long way, so we can use that to sort of plot what we would expect to happen otherwise. And I think some of the stuff that you might be more doing here with you've got much better data, but it's over a shorter time horizon. And there are some interesting methodologies that you might hear about at some of the other sessions around like synthetic controls, or sort of can you sort of create an almost imaginary population and test things out on there about what you think would have happened if you hadn't have done your intervention.
Now, I'm just mindful of time because I can see the red numbers coming up. So I don't know who's coordinating here. Are we okay for one more question? Or do we stop? One more? Okay. كان رافع الرجال. بس we'll stay here. Please ask me.
Commitment for appointment globally. We do some experimental in Fujairah Hospital. We did that. We changed some messages to the patient to encourage them to come to their appointment. These messages, for example, in Arabic say, لديك موعد, for example, experimental messages, لديك موعد في اليوم كذا كذا, ان التزامك بالحضور، ان عدم التزامك في الحضور المواعيد العلاجيه يكلف الاخرين على قائمه الانتظار. This messages تقدر تقول فيه نوع من التعاطف، يعني empathy. This messages encourage the patient to come their appointment. We saw the different more than 20% committed to their appointment, less than the other committed. We do another project such as for diabetics. Patient. We did so many, we keep the dietitian clinics, it's free for the patient, and we encourage them to, any patient, he came to visit a diabetic, we give him an appointment, very near appointment. So we encourage the patient to come for diabetics. For example, عندنا مثلا قائمة الانتظار على جراحات السمنة تاخذ مرات 6 شهور سنة. this patient نقول لك كل ما راجعت انت عيادات الدايتيشن أكثر كل ما حصلت القائمة أو موعدك للحضور للعملية ليتس. فشو سوى الناس؟ راحت للقائمة الدايتيشن، وبالتالي أصلاً هو ما يحتاج للعملية فيما بعد. this is some يعني أيضاً we change for we encourage the patient and the visitor to use stair more than use the lift for when you're walking in for outpatient or for inpatient.
I love hearing this.
Yes.
My mission is, so your point about all you need is a minor adjustment to make a big change, that applies whether it's in healthcare, whether it's in tackling obesity, which is beautiful. My mission is to have people not need your hospital in the first place. But I mean that's in the nicest way, of course.
Yes, yes.
But I love the example that you're giving, that even when they are in the hospital, that you're encouraging them to take the stairs, and the way that you're using these behavioral nudges for their attendance is very important, because people are sick and they need good care.
Yes.
Thank
you very much.
Thank you. Thank you, everyone.
Thank you, Your Excellency Hugo, for this insightful discussion on a very important topic. And I really look forward to seeing how the government and private sector are going to work together to address this wicked social and health issue. I think that's it. Thank you, everybody.